So again, welcome everyone. So the UCL Global Business School for Health is the first business school actually in the world that's totally dedicated to health. And one of the reasons that it's important is that health and healthcare are such a major component of economies today, so much more important than ever before in terms of our thinking and how we go about really navigating the kind of health space, but moreover, how we manage our economies, how we think about society, demographic changes, climate change, and also social determinants of health. All of this has really come together to make health a much more important topic, particularly in terms of health care. And yet, in most business schools, healthcare gets a real footnote. It's often just a bit of a side. So we'd also argue at the Global Business School of Health that health and healthcare management are extremely important, and they make up not just an important part of GDP, but health systems vary significantly, and they're not like other products or we're talking about patients. These are really caring sector that needs really people who are not just thinking about the bottom line and how to cut costs and increase revenue, but how they can actually invest and make decisions that can have transformational impact on society, on the lives of people, of patients. So that's why we really believe that by creating a school, and so the MBA is, of course, our flagship program, but we've got other programs as well, and bringing a group of people together who are all passionate about really making societal change, about really making a difference for patients and just humankind in various ways, is really a worthy project for us to undertake. So that's really a bit about the school. And let me just make sure, there we go. So that leads me on to my next slide, which is why an MBA in health versus a general MBA. And many times I hear people say, oh, well, I want to get a general MBA because I want to learn all about business. So I just want to assure you, first of all, that this MBA that we've created in the Global Business School of Health is aligned with the Association of MBAs. We can guarantee you that it hits all the kind of criteria and boxes that you would expect in a general MBA. The difference is that in some of those general MBAs, they might have a module or two that you can take in health, but they don't really integrate health into the cases, the examples, into the program throughout. So we believe that given how health systems vary across the world, given how global health governance varies across the world, given the just way in which health and healthcare are changing and the need for them to change to really address access and a wider community in terms of people who need health and healthcare, and not just in terms of treatment, but in terms of prevention, in terms of diagnostics. We believe then that the complexity of the health sector really mandates for an MBA that's really cross-disciplinary, that gives you all those general business skills, but then also exposes you and challenges you by having health professionals and medical professionals, as well as business and management professionals, teaching you and working alongside you. So why even do an MBA? Well, again, and I have students sometimes come to me and they ask me, what's the difference from doing an MBA and doing, a more general degree or an MSc? Well, I'd say, first of all, the MBA is really a very unique experience. It's created and designed with really the student experience. And it opens up all sorts of career opportunities that doing either an MSc or a general MBA wouldn't. We put a lot of energy into and thought into designing this program to make it something that really focuses on you, your personal development. And such a program is probably one of the most important investments you will actually make in your life, in yourself. So it's really about, looking to accelerate your career, build your self-confidence, shift you from really your kind of individual contribution that you may be making in your workplace now, and to really create something where you're managing others more effectively, where you're seeing and able to move from kind of operational tasks to strategic tasks. So the potential to really build your career and pivot your career is immense in such a program. And most MBA students are really looking for experiences that go beyond just content, and they want to really become decision makers and feel confident in those decisions. So that's really much of what this program is about. The other thing is, should I get an MBA, and which kind? And so again, there are as many versions of the MBA. There are what we call executive MBAs, there's online MBAs. This particular MBA that I'm going to tell you about today is a full-time or part-time delivered in a face-to-face in block delivery. There is definitely online work. So it's really more like a boot camp. It's really where you go and you get trained in healthcare management, and with a focus really on that healthcare scape, but with a real focus on management and leadership. So there's loads of technical skills that you'll get. You'll learn a lot about finance. You'll learn about health economics, the digital space, analytics, but you'll also get, what is often referred to as soft skills, communication, both in terms of, how you present. You're going to be presenting a lot in this program. You'll be doing real world cases. You'll be providing answers. You'll learn how to, go through lots of information very quickly and then present it back in a very coherent way to convince audiences of its credibility and make decisions. And this is where a lot of people find the MBA so important, is really learning how to be a confident decision maker. So when should you start such a program? Well, this program is really designed for people who are early in their careers as well as mid-career. It's an opportunity to really step out for a year and get really that kind of acceleration in what you do. It can also be an opportunity to pivot. For people in mid-career, it might be an opportunity to reboot after years working in a particular job. Maybe you want to pivot into the health sector and you come from another sector. And then why UCL? Well, first of all, UCL is ranked 8th in the world, and much of that is about its research and education. And it's first in research in the UK. And again, much of what UCL is about is truly about health, medical, and life science. And that's really at the heart of this university. So that's why in this MBA, we can not only give you the business and management skills through our experts in these areas, but we can really bring in that cross-disciplinarity and people from across UCL, as well as from industry, who really take serious what we're doing here and trying to accomplish through this MBA. So that's really what makes our MBA stand out, is that we really understand the health sector from a number of lenses, and we can pull that all together. And health for us is not an afterthought. As I said earlier, our program has been specifically designed for health leaders of the future with cutting edge contemporary topics. And we've really stuffed this program with lots of resources and opportunities for you to engage with the sector. One program I just want to take a moment and talk to you about is our program called Executives in Residence. We are assembling 25 CEOs, former CEOs, health leaders who will be ready to mentor you and engage with you for career advice and opportunities. Throughout your program, you can book office hours with them and really look to them to give you that kind of support that you need, in addition to our career services and recruitment. We also have a recruitment agency that's going to be working with us. They'll work with you right from the beginning in your induction. They'll help you with, evaluations. We'll do a psychometrics exam. We want you to really have, a very clear idea of what your journey is going to be on this MBA, what you want from this MBA. and how best to leverage this opportunity to maximize its potential for your future. The other thing is once you're alumni, you can come back and engage with us. We have a portfolio of executive short burst face-to-face programs and online programs. You'll have the opportunity to be a lifelong learner with the Global Business School for Health at UCL. So, and that really gets me to my final point. This is an opportunity to make connections worldwide to other professionals that really, they'll be your peer group, and trust me, they really will be, not just in terms of while you're on the MBA and working side by side, but people you'll come back to over and over. So as I said, the kind of typical MBA health student profile is someone early or mid-career who's got a good academic or kind of clinical background with some work experience. And that work experience might be alongside your training and education, or it might be full-time. But we really look for people who've had opportunities, and that can be volunteering, it can be internships, it can be full-time work, but it's really that background of work with education that makes the experience and your ability to contribute to the MBA so important. We're also looking for people who are ambitious and determined, who want to really make a difference and have societal impact, which is really what is at the heart of all our degree programs here at the Global Business School for Health. So it's looking, for people who might want to build a career in healthcare management, pharma, biotech, consultancy, work in a hospital, the NHS. The opportunities are immense. So it's really about accelerating your career, helping you get a focus, and helping you gain those networks. Some of the career destinations, are important. So, I talk to people almost every day about the MBA, that many of them want to go into health consultancy. And this past year is a real testament to these big four consultancy firms. They've had one of the biggest years in history because many organizations are struggling to adapt to the pandemic. And it's not just general businesses, lots of health organizations, the NHS, are trying to find new ways and accelerate change. So consultancy careers are a very important part. Many people from our program will go on to those kinds of careers. Others will go into senior management roles in the NHS, in biotech, pharma, public health, or global governance organizations like the WHO. And then, of course, there's those who might want to go into startups, health tech, med tech, health analytics. The opportunities are immense. And medical directors and other C-suite roles might be something that you're aiming for. So now I'd just like to tell you a little more about the program itself. Before I get into the specifics of the program content, I'd like to just tell you that really this program is designed for a variety of individuals. We've done that on purpose. We don't see healthcare or the healthcare space reserved for just consultants and clinicians. We see this as a much bigger space. And I think one of the things that we're learning as societies as we go forward is that to make a real difference in healthcare, to be able to really meet the demand, we have to upskill, reskill, and change mindsets. And part of that is recognizing that people from a variety of backgrounds, whether it's the humanities, social sciences, business, can contribute very importantly to this space. We can't actually train enough consultants or clinicians to meet the demand. We're going to have to think about how we use technology, how we use artificial intelligence, how we really create something much more interactive and really build along those health professionals, those medical professionals, the kinds of environment that really makes a difference. And to do that, to really reimagine healthcare management, you need the skills that you'll get in this program, skills that will help you see and think in a different way, really transform you. So what does the program look like? So let me just walk you through the journey. You'll apply to the program. Once you're accepted, before you've even begun any courses or come to campus, we'll encourage you to take some online primer courses. Those courses are designed to help you with study skills, to think about time management, but also a module in global health, finance, economics, and accounting, because we often find MBA students struggle with those topics. These will all be available for you. They're optional. They'll be self-paced, and there's something that you can do before you even join us. It's about helping you come and join this program really confident. Then when you come, you'll have a 2-week induction prior to the start of the program. And that will be really focused on personal development, organizational behavior, and team building. We'll be putting you into teams very early using the psychometric exams that you'll take. And those teams will be the teams that you'll work on the Global Health Challenge that I'll talk about in just a minute. Also, within those 2 weeks, we're going to take you away to a 3-day residential off campus to really help you build your cohort belonging, but also to teach you and develop your understanding of the healthcare landscape, particularly health systems. So we'll have a number of speakers joining us, interactive exercises and opportunities for you to really feel confident once the program goes. And I think about the program in 2 ways. It's a marathon with lots of little sprints. So the way the program is structured and delivered is really important for you to understand. There's 4 what we call blocks. And within those blocks, you can think of almost like 3 courses in each block. So you will have an online Moodle is our learning platform. And on there, before you come in for your first day, you'll have cases to work through, readings to do, videos to watch. Then you'll come for the first block. It runs for 4 weeks. It's called Strategy, People, and Marketing. During that 4-week block, you will have one intense week, each day, Monday to Friday, on strategy. The next week will be on organizational behavior and human resource management. That's the people week. And then the 3rd week will be really about marketing and healthcare marketing. And then we have a 4th week, which we call wrap-up week. It's where you reflect on all of these with a much bigger focus and lens on healthcare. So we'll have people from all sorts of industries who do jobs within the healthcare space in strategy, people, and marketing coming in and working through cases with you, talking about their experiences, and really bringing the material alive in a healthcare management context. Then you'll have 2 weeks to prepare for the next block. The next block is called Funding, Finance, and Regulation. Again, you'll have a week of financial and accounting reporting. You'll have a week of corporate finance, and you'll have a week of healthcare policies and practices, all followed up again by a wrap-up week. Then you'll have your assessments, you'll have your holiday break, and after that, actually, you're going to come back to one of these projects, and I'll come to that in a minute. The 2 other blocks that you'll take in 2nd term, one is called data-driven management. So again, you'll come in, you'll have a week of economics and health economics, a week of analytics and visualizing of health analytics and records. And then you'll have a week on sustainability. And then again, a wrap-up week. And then your final 4th block is called Contemporary Topics in Health and Healthcare. And you'll have a choice of a number of things for those various weeks. You'll pick from those. Those will be things like, systems leadership, digital health and innovation. You'll have things around, data analytics. You'll have human factors of digital health. You'll have leadership in healthcare. So there'll be lots of topics that you can pick from, and then you'll take those over the 3 weeks. And that 4th last wrap-up week will be, again, around reflecting on contemporary topics in healthcare. and what does that mean, and the kind of horizon scanning that you'll need as you go forward. And those topics, we will be presenting those very, very soon for you, so that you can see what the choices will be. And then in addition to those 4 blocks that you take, you're going to work on 2 really interesting projects. So I want to just take a moment and talk about the first one. The first project is called the Global Health Challenge. So as I mentioned to you, when you're in your induction weeks, you will be put into a team. That team, we'll construct that team because we want you to learn what it's like to be in a high-performing team. So we'll use some of the testing assessments that we give you to place you in a very diverse team to work on the project in. You'll also have some UCL academics and some industry experts that'll join you on that team. You'll have a project. You'll be looking to find a healthcare solution to a problem in a lower middle income country. Countries that we're looking at right now are places like Nigeria, Egypt, India. And then you'll work on the project. You'll have some workshops across term 1. And then in January, after the new year, you'll go for a field component, a field experience to that country for 2 weeks. And that's going to be very important, that experience in the country, because you'll be collecting more data, you'll be meeting with people, you'll be learning about the health system. And then when you come back, you'll be, again, working across term 2. And then in term 3, your final term of your program, you'll pull all that information together to produce a group research paper and presentation about the solution that you've come up with. So it's a fantastic experience to really see what it's like to be, have that field component in a consultancy project where you're finding a solution to a health problem. The other project you'll do, which you'll start in term 3, is called Health Consultant Project. Again, we'll be working with industry, the health sector, the NHS, to come up with a number of different projects that you'll shape and engage with, and with either yourself, depending on the project, with others on your program. And this will give you an opportunity, again, to get in-depth knowledge on how to undertake effective consultancy projects in the health sector. And these projects, by the way, will not be just in the UK. They can be anywhere in the world, depending on the sector and individuals that we're working with. You'll also work with your career coach, and we will have career events across the year. Your career outcomes are paramount to us. So you'll work with them to also make sure that your consultancy project really aligns with what sector you want to go in, whether it's public health, whether it's an NGO, a charity, it's a consultancy, it's a private health firm, it's the NHS, or a public health hospital or organization. We want to make sure that you get the right kind of experience so that your health consultancy project is something that you can proudly have as a consultancy experience that you can share and help develop and use as you recruit and move forward in your career. So that's really a lot of information about the program. So I now want to just really turn to, who's the program for and why. So really, we see this program for ambitious individuals. Our mission as a school is to really develop the next generation of healthcare managers and leaders. We want them to be disruptors. We want them to be courageous leaders. So this is why we've developed a really comprehensive and very novel program that really will stretch you in many ways. I can assure you that when you finish this program, it will have been a transformational experience. So we're looking for people who are managers, clinicians. You can come from a business background or a medical consultant background who wants to really elevate your career. And again, it can be in the public or private space. We really believe that the health and healthcare sector itself is so large today, taking up, as much as 10 to 20% of GDP in some countries. and the diversity of needs and the ways in which we need to approach a health, our classes will be quite diverse. But what will all of the students in our MBA course share in common? A desire to make a real difference in healthcare. So if you're, in a professional job, you've never really done anything in the health sector, but you want to pivot your career, this is the MBA for you. And if you're already in the sector and you want to make that next step up, you want to widen your learning and understanding so that you can position yourself into healthcare management, this is also the course for you. So now I just want to talk about our admissions and entry requirements, because that's often where we get most of the questions and the inquiries. So we're looking for students who have a bachelor's degree and who have, gotten a second, an upper second class, which is a 2-1 in the British system, or an equivalent overseas qualification. Having said that, though, we're also very interested in graduates who have maybe don't have the relevant degree classification, but have extensive relevant work experience. We want to consider those individuals as two, and they will be considered on an individual basis. You need to have an IELTS exam and on the level 6.5 or above, and no lower than a 6 in any subtest if you aren't from an English-speaking country. In terms of work experience, we prefer someone who's had 3 years of postgraduate professional experience, but we also realize that people work alongside their education and that some people gain work experience through internships and volunteering. So the work experience is for something for you to articulate both in your personal statement and on your CV to show that strength of experience. And the reason we want some work experience is because it will help you get more out of the MBA. It'll help you reflect on what you're learning, to think about your experiences in the workplace, the kind of decisions that you've made. So again, if you've got any questions about that, feel free to reach out to us. We do look for you to take the GMAT or the GRE. We're looking really for a balanced score. I think the average now for most people who take the GMAT is around 550. You can take, and I'll talk a little more about how to take the exam. You might wonder why we're asking you to take a GMAT. It's because you're going to need to assimilate and digest a lot of material in this course. The GMAT really is about your critical thinking, reasoning skills. So we're really looking to make sure everybody's got a baseline. We want you to be able and be assured that you can succeed in this program as you move through this fast-paced program. And then there's also, of course, your personal statement, and you're going to have 2 references. And then last but not least, an interview. And the interview I'll talk about just a little more in just a second. But before that, I just want to mention the GMAT exam. We get a lot of questions about that, particularly now. People aren't quite sure how they can take the GMAT. The GMAT is an online exam that you can take. There are also lots of opportunities online to take free practice GMAT tests. So I would really encourage you to Google and find a place that you can take a practice exam. As you'll see, it's about analytical writing, integrated reasoning, quantitative skills, and verbal skills. And we're not looking for necessarily a particular score, but we are looking for people who can demonstrate some success across those various areas, because we want to make sure that the students we take into this program can get the most out of it and succeed. You can take more than 1 attempt, and your highest score is what will be recorded and reported when you're ready to do that. So, again, if you've got any specific questions or concerns about the GMAT, please send us an email. And then, that last part, people often ask, why do I have to have an interview? Well, the interview is really about us and you getting to know each other more, about making sure that your expectations match the experience that you're going to have in this program. So I've just listed here really what will be the kind of common interview questions that you would anticipate from us. You know, telling us a little more about yourself, why this MBA, you know, why you think you're an outstanding candidate, what can you contribute to the program, what you are you expecting from the program, and then really a little more about your main strengths and weaknesses. And, you know, I know it's often a cliche question, but where do you expect to be in 5 years? You know, it just gives us a little more sense of what you're thinking is as you join us in this program. We also have some scholarships, and we're in the process of developing more scholarships. So if you know you're accepted in this program and you need some assistance above and beyond the scholarships that I've listed, please again email us. We want to try to make this program as affordable as we can, and not, you know, and is open and get as many students from different backgrounds. So we have 3 scholarships currently available within the school. One is called MBA Health Future Impact Leaders, and it's for people from low and middle income countries. And you can read on our website about how to apply to that. And that's up to £15,000 for the MBA. We've also got a Women Healthcare Leadership program that will give you £5,000, and all of this will be reductions in your tuition. And along with this program, students will have the opportunity to engage in a leadership development program above and beyond their MBA, as well as get individual coaching. And then last but not least, we have our East London Healthcare Leaders Scholarship, which again is up to £5,000 for people who live or work in East London. So again, these are just some of the scholarships that we offer. At UCL, we've got lots of other scholarships. And if you're struggling to find a scholarship that matches your needs, again, write to us. We'd be happy to connect you to the right people, and also to explore other options and ways that we might assist you in funding your MBA. But here is just a few. If you're coming from the US, you can of course apply for federal funding. And there's also a number of various scholarships for international students. We've got, by the way, a session in another week just on scholarships and funding. So please, again, attend that event. So just to wrap up, this really is about your career. This is about supporting you. It's about really developing healthcare leaders and managers for the future who will really make a difference. We're really keen to see our program make an impact in health and healthcare. Trust me, once you're an alumnus with us, we'll be contacting you throughout your life, because we want to make sure that we are living up to our mission. So this program is just full of career opportunities. We'll have lots of speakers and activities across the year. As I mentioned, you'll have your executive and residence program, but you'll also have industry mentors, people who will be helping you with your project. You'll be meeting just scores of speakers from all different aspects of healthcare management. So it's really a whole package is really focused not just on building your confidence, your case skills, your decision-making, your presentation skills, your ability to really understand the wider and changing nature of the health ecosystem and landscape, but to really make sure that we give you the opportunity to meet your aspirations and that you leave with career outcomes that you set for yourself at the beginning of this program. So that's really our MBA, and we're really excited and to have you listen and join us. But I just want to tell you a little more just really quickly about UCL, because I want to make sure that you realize this is not going to just be a lot of hard work. It's going to be a lot of fun. You are going to have such an enjoyable time being with the peers that you have in your program, but also being at UCL, which is just an amazing university to study at. So our student union has lots of clubs and societies. I'm really hoping that our MBA health students will set up an MBA health club. And there's opportunities to volunteer. There's also, if you're, feeling that you need extra support, anything about your health and well-being, we've got a fantastic student support and well-being team that you can tap into. We've also got amazing student union advice services. So you're really going to be covered when it comes to your student support and activities. Also, we're going to be located in East London, and East London is a really special part of London. It's a growing, developing, probably the most fast growing part of all of London. UCL's building an incredible campus there. It's state of the art. It's exciting new student accommodations. It's the East Bank culture and education destination. There's lots of places to shop and to visit. And then, of course, moreover, we're in the City of London, which is just a tremendous place to be. Not only is Bloomsbury the home of UCL, there's lots of tourist attractions, sport events, facilities, parks, and greenery. So UCL is really at the heart of London, and London is at the heart of student experiences. As you can see, it was ranked top city for students in the UK in 2021. So that's really it for me. I hope you found this presentation useful. Again, we really want to be shepherding you, supporting you through your application process. Any questions that you have, we really recognize that this is a huge decision that you're making, a real investment in yourself. It's really exciting, but it can be also very anxiety-ridden. And so we want to do everything we can to really help you understand the offer and the opportunity here at UCL. So please feel free now to ask any questions. I'm going to stop sharing my presentation and look forward to engaging you. So first of all, are there any questions? Can I answer any questions? I don't see any in the chat. I'm going to give it a few minutes. I'll just, to get things started, I'll talk a little more, about the school and the program. And then while I'm talking, hopefully some of you can come up with some questions. So one of the questions I often get from individuals is should this question about a general MBA versus specialized MBA. I really believe that regardless what you end up doing, having this MBA, having this kind of intense experience will serve you in so many ways. It will give you really the kind of level of complexity, because the health sector is a very complex sector. It's not like other sectors in the sense that, you think about retail and some of these other sectors. And, if you're in the Middle East, if you're in London, if you're in Singapore, the way the sector works is relatively the same. Health is so unique in the sense that health systems, there's almost a different health system for every country in the world. So one of the things that we're really going to put a lot of emphasis on is, how do you identify best practice? I hear lots of people talk about best practice. I'm not sure often if they know how to identify that. That's one of the things that you'll really get in this MBA. You'll have an opportunity, to work on a number of different kinds of cases that really will stretch you across the world into different health systems, different problems. And I think there's also an awareness that you'll get about the fact that some of those best practices are not just reserved for places like the UK, but they're really can be found in lots of interesting ways. So it's how do you get that mindset? How do you build criteria to think about best practice? How do you get that kind of comparative perspective? So I think, that's something, that I think will be a really interesting part of this journey on this health MBA. So I got now, great, thank you so much, Sujay. Shah has asked a question. Is there a significant difference in content between the part-time 2-year program and the full-time? No, there's not on this program. This program is really designed. So if you were to do it part-time, you would have to be able to come 4 weeks in term 1 and 4 weeks in term 2 over 2 years. So you would, rather than taking 2 blocks in a year, you take 1 block in each term. So that's that, and you know, so you could also, you know, we could look to say that you would do in term 1, you might do the strategy, the human resource and marketing, you know, block, or you might want to do the finance, funding, and regulation block. But you do 1 in your term 1, and then you do 1 in term 2, and you do that over 2 years. So it's essentially taking this and stretching it over 2 years. Now in 2023-24, we'll be adding an executive MBA, and that will be mainly online and will be delivered synchronously and asynchronously online. And that will be pretty much delivered on a Friday and Saturday. And that is definitely a part-time MBA program. And we'll only have a 1-week residential over the 2 years. So again, I want to be clear that this can be done part-time, but it's really been designed to be an in-person MBA. And so that's why we've got these kind of blocks that we deliver. I hope that answered your question. Then the next question is from Helen. I just want to find out if the university can offer full scholarships from someone from a developing country. We're looking into that. Right now, we don't offer any developing full-time scholarships, but I'm hoping by in the next several months that we'll go out and be advertising for those. So again, I would recommend that you apply to the program and keep an eye out as we evolve. But there are ways, even if you don't have 1 scholarship, you can put scholarships together. So, you know, you might be able to qualify for a couple of the scholarships I just mentioned. You might also find some other scholarships offered through other channels and through UCL. We'd be happy to talk to you about how you build that kind of scholarship, you know, through multiple scholarships. So again, my aspiration is that, you know, in the new year, we'll be able to add some full scholarships. We don't currently have them right now, but we do have, you know, some substantial scholarships, and UCL has other scholarships. So it's about thinking how you can bring a number of scholarships together to reach your funding needs. So I hope that answers your question. And again, feel free to email us, you know, if you want further information or assistance in thinking that way and taking that approach. So really, I'm going to just give it a few more minutes and see if we have any other questions. You know, again, one of the things I want you to realize is that you're going to get all the rigor of a general MBA, but with a real healthcare focus. And the other thing that I think really, for me personally, makes this program so exciting is we've got a number of very prominent, you know, health professionals, healthcare managers, leaders who will be joining us, not just as executive in residence, but they'll be coming in, they'll be talking to you about their experiences. And they are so excited about this school and this program. And they really want to shepherd and mentor the students that come on to this program. So I think for me, that will be a huge difference. You know, it's always very exciting to be a part of something that's really purpose-driven, that has that kind of social mission and impact. And I think very much that's what this MBA is about. And I think the career opportunities are just incredible. You know, and I know that many people, you might be thinking about where you're at now, thinking about something very contextualized. Trust me, when you finish this program, you're going to be in a very different space, both in terms of your thinking and in terms of the opportunities. This is not an area that's going to retract. It's just going to continue to grow. Sadly, we have to, really address multiple challenges in this space. And those challenges, range from, of course, aging societies, and even, we can talk about certain regions in the world with youthful societies, but those societies will be aging quite quickly. And that presents lots of comorbidity, health challenges, access problems. The other thing is, we've heard lots of talk recently about climate change, and climate affects health and the social determinants. And we see that in many countries, actually, the economy, the inequalities is actually deteriorating. It's getting worse, not better. And that will lead to more and more health challenges. So this is really about creating people who can think out of the box, who understand systems, processes, who can make really intelligent decisions that can affect and change and impact within society. Another question I've got, you said the Global Health Challenge project can be carried out in developing countries like Nigeria and India. Is it possible for anyone to choose to do the project in his or own country, especially those from developed countries with health issues like Cameroon? The project actually is an opportunity for you to work as a team. You could do your health consultancy project, which is also a substantial piece of your work, and that you could do in your own country. And we could work with you to identify and shape a project with the health sector in your country. In terms of the Global Health Challenge project, what we're really looking for there is for you to work as a team with your colleagues and to learn team skills, to learn how it is to work with diverse groups. And much of what you learn, you can take back to your home country. And that's really the intent there, is to teach you, we talk a lot in business about high performing teams, the need for equality and diversity and inclusion. But many of us don't really understand what that feels like. We've never actually been on a team like that. So what we're going to be doing is we'll be putting you in teams, actually, even before you start your project, to help you start to work with colleagues and to learn what it's like to work with people from diverse backgrounds and on diverse projects. So actually, it's better for you in terms of that experience to work on a country and a project that's not your own country, but you can do your health consultancy project on your own country, because it'll be an incredible opportunity for you to see best practices, differences in health systems, how different countries work and shape some of these challenges that I'm sure you have in the Cameroon, but which expands your knowledge and background. And again, what we're really trying to do here is, indirectly, you'll get exposed to lots of health systems thinking within a business and management context. And that's really important. We see finance of healthcare. I had someone just a day ago say to me that oftentimes they think of MBAs as people who come in and really have a cost-cutting kind of mindset. What I'd like to hope that we will develop in the students in our MBA is really an understanding of seeing health not as a cost, but as an investment. But to do that, we do need to think about how we get value-based healthcare, how we think about who the payers and providers are of healthcare, and really explore some of these topics in much more depth so that we can think about how we could reimagine a whole new way of designing and thinking about health systems. And then last but not least, it's about that global healthcare governance that's changed so much. It's not just about the World Health Organization. It's about private-public partnerships. It's about philanthropic organizations like the Gates Foundation. It's about thinking about intergovernmental organizations. So really, as much as we want to be contextualized in our own country and health system, we want to give you the opportunity to really think differently, to get exposure, to lots of different parts of the world, lots of different healthcare programs that will help shape you as an individual and someone coming on to this program. So I'm just going to wait one more minute. If there's no more questions, I just, again, want to really emphasize that we're here to support you. We're very excited to make this journey and experience of applying as important and worthwhile for you as actually being on the program. So again, thank you so much for your time. Have a lovely weekend. And I look forward to getting to know you once you've applied and hopefully join us in September. Take care. Bye.